Welcome to this Surgical Explainer. Today we're going to step back in time all the way to 1976 to break down what is truly a masterclass in open cancer surgery. We'll be walking through the resection of a huge kidney tumor that had actually grown into one of the body's biggest veins. What we're going to see are these timeless principles that honestly still guide complex cancer operations today.
And this is the age of our patient, just 7 years old. So right from the start, we're dealing with a young child facing an incredibly complex and really high-risk procedure.
So here's the core of the problem. Pre-op imaging confirmed this wasn't just a tumor contained in the kidney. Nope, it had actually grown a thrombus, which is like a cancerous clot that extended right into the inferior vena cava. This just changes the whole game. It skyrockets the complexity, the risk of massive bleeding, and the potential for what we call a tumor embolization, where bits of that clot break off and travel to the lungs. It's a nightmare scenario.
So to really get how the surgeon tackled this, here's our game plan. We're going to follow the operation step by step. We'll start with the incision, move through that really delicate work on the blood vessels, and then follow it all the way to the final removal and closure. Okay, let's really dive into this case. Understanding the patient's specific situation and the anatomical puzzle here is absolutely key to appreciating the brilliance of the surgical strategy. So these are the events that led them into the operating room. A young patient, and then a definitive diagnosis from angiography showing that vascular invasion. Now this is crucial. It means the team wasn't just going in to see what was up. They were going in with a very specific, incredibly high-stakes plan to get the entire tumor out.
All right, let's get into the first phase of the actual operation. Now, in a case like this, how you start is literally everything. Getting great exposure is the absolute foundation for a safe and successful removal.
Just notice how methodical this approach is. First, you get a huge incision for a wide-open view. No peeking through a keyhole here. Second, you look for any distant spread. If the cancer's already everywhere, a massive local surgery might not be the best thing. Only after that does the surgeon start creating the field by moving the colon and duodenum, getting them safely out of harm's way before even thinking about touching the tumor itself.
Now this slide highlights a classic, and I mean essential, technique. It's called the Kocher maneuver, and it's a fundamental move in abdominal surgery. By lifting the duodenum and moving it toward the middle, the surgeon basically unroofs the great vessels, the vena cava and the aorta. This gives them the wide-open access they absolutely need to get control of the blood supply.
And that brings us right to the heart of the procedure. This is, without a doubt, the most dangerous part. We're talking about precise, careful dissection around the body's biggest blood vessels. One wrong move could lead to catastrophic bleeding or send a piece of that tumor flying.
This highlights a core principle of cancer surgery. You get vascular control before you start messing with the tumor. Why? Because by controlling the arteries and veins first, before you start pushing the mass around, you dramatically lower the risk of knocking cancer cells loose into the bloodstream.
And this right here perfectly illustrates the artery-first technique. By tying off the renal artery first, you stop blood from flowing into the tumor. This depressurizes the whole system, which means less blood loss when you finally tie off the vein. And it helps keep the kidney from getting all swollen with trapped blood. It's a beautiful, deliberate, step-by-step process.
Okay, so the blood supply is now completely cut off. The surgeon can finally move to the last phase, removing the entire specimen. And the goal here is to take everything out in one single intact piece. This shows you what we mean by an en-bloc resection. Notice the surgeon isn't just carving out the kidney. No, they're taking the fatty tissue around it, the adrenal gland that sits right on top, and all the lymph nodes along those great vessels, all of it as one unit. You do this to make sure you have clean margins and remove any potential microscopic disease that might be hiding.
This comparison really says it all. Look at the dramatic change in the surgical field. On the left, you've got this dangerous, messy space completely dominated by the tumor. On the right, you have a clean, textbook-perfect anatomical field, where the great vessels are totally clear and all the bleeding is controlled. And that one single tiny suture on the vena cava? That's a testament to just how precise this dissection was.
All right, let's get to the final steps. Getting the tumor out is the climax, for sure, but a safe and thorough finish is just as crucial for the patient's future. This is a massive safety check. Wilms tumors can be bilateral, which means they can actually pop up in both kidneys. So before closing up, the surgeon takes the time to expose and very carefully check the other kidney, the left one, to make absolutely sure it's healthy and tumor-free. This detailed multi-layer closure, it isn't just about sewing up the skin. Each layer is carefully brought back together to give the abdominal wall strength, prevent hernias down the line, and reduce the risk of wound infections. The fact that they're using different sutures and techniques for each layer, well, that's just deliberate, expert craftsmanship.
And there it is. That simple, totally understated sentence from the operative note. It signifies the successful end to an incredibly difficult and challenging operation. It's the direct result of meticulous planning, precise surgery, and sticking to those fundamental surgical rules.
So as we wrap this up, this case really makes you think. It doesn't matter if the surgeon is holding a scalpel, like they did in 1976, or if they're at the controls of a multi-million-dollar robot today. The foundational principles we saw here, they are the absolute bedrock of cancer surgery. The goals haven't changed. Get wide exposure, get early vascular control, and take the tumor out and block. Those ideas are timeless, no matter what tools you use to get the job done.